is Melissa Flores, and I am a counselor at the Glenn Biggs Institute for Alzheimer's and Neurodegenerative Diseases at UT Health San Antonio. And today I'm going to talk a little bit about the importance of self-care and the overall need for care for the caregiver and how you can provide that care for yourself. So we're going to talk a little bit about ideas for self-care and just why it's so important to make sure that you are taking the steps necessary to have your own needs and priorities be met. So especially with the time given, what's going on in the world right now, it's really important to take certain steps to make sure that even though you may be home or may be more responsible for a loved one, your needs and your actions are still a bit focused on what it is that you need to get done. So, it is so important, the idea of self-care, although it feels a bit strange to shift the priority and focus on yourself rather than the person you're caring for, there is a huge need for it. And I hear often that it feels a bit strange or selfish, the idea of caring for yourself first. But I like to really emphasize that in order to care properly and at the best level that you can for someone else, you yourself have to be feeling in a good place. And so really, I like to share with caregivers that although it feels like an action for yourself, it really truly is an action for the person you're caring for to take care of yourself. If you can do things that will make you feel good, that'll in turn make you a better caregiver and a better, person to be around. And so it really isn't selfish action. It's an action that you're doing out of love for the person you're caring for. By taking care of yourself, you're taking care of them. So that's really the importance of self-care. Now to some specific ideas on caring for yourself, and especially, again, a lot of these will be geared towards the idea that maybe some of us are home and are maybe a bit more stuck in the house than usual or isolated. And so these are some ideas and things that you can do to really care for yourself and get your needs met. The first thing is always seeking support. Now that doesn't have to be physical support. I know our physical interaction is a bit limited, but seeking support, reaching out by phone, asking for a video call, for friends or family, those are still things that can be done. If you are finding yourself feeling lonely or need, to communicate with someone, don't be afraid to ask if they have some time in their day to schedule a FaceTime or to schedule, a phone call where you can just talk a little bit about what's going on. The biggest step in getting support is seeking support. So I really encourage you that if that is a need of yours, to take the steps necessary to get the support you need. The other idea is taking care of yourself physically, emotionally, mentally, by making sure your own health is a priority, especially given what's going on right now. If you feel that you are yourself feeling ill or needing medical attention, not just powering through it in order to take care of the person you are caring for, but really making sure that you're seeking medical attention as much as necessary to make sure your own health needs are being met. That's, again, going to help you care better for the person you're caring for if you take care of yourself first in that regard. Along with that comes eating well, a bit of exercise. We always encourage healthy eating, not just snacking throughout the day, especially when we're stuck at home so much. We may not have sort of planned meals as much as we did before, but maybe trying to schedule those meals, scheduling, certain snacks, or looking at the food that you have and figuring out when it will be eaten so that you're not sort of eating poorly and kind of eating throughout the day, but rather having these full, well-balanced meals. Exercise is very important, and whether that be inside the house, but I also encourage going outside of the house. We, even in a time of social distancing, we're still allowed to go out of the house and kind of take some walks around the neighborhood or take some time in our gardens or yards, maybe even bringing your loved one outside with you, bringing a chair, just getting some of that time outside, breathing in that fresh air and getting some sun can be really important for overall well-being. Some relaxation strategies. When you are feeling very stressed or overwhelmed, we have a couple of other videos that focus on how to do some certain relaxation strategies that we talk about. These can be really crucial and helpful in reducing our stress level when we are feeling overwhelmed or anxious, and that can in turn make us a better caregiver if we can get our own stress under control. Being realistic with your goals and with your actions it's okay to have a day where you sit at home and just watch movies all day. And then maybe the next day you plan for things to be a bit more active or involved. And being realistic that not every day is going to be a perfect day, and that's okay. That's not a reflection on you as a caregiver, but rather sometimes circumstances that we can't control. So being realistic and being kind to yourself and knowing that you're doing the best that you can with what you've been given and the situation you've been given. Know when it's time to take a break or maybe having some alone time, figuring out if there are ways in the day that you can take a step back if you need to. Going to the other room or taking a few minutes to really be by yourself can be important. And going back to support, we talk a little bit about accepting offers of help, whether that be maybe you don't need to venture out to the grocery store, but somebody can deliver your groceries or drop them off for you. Whether that be somebody that you know and trust can come and sit with your loved one while you go outside for a few minutes. These are all ideas, but you can incorporate them and make them your own. But accepting help that you feel comfortable with is really important. No one can do everything alone. And so we really encourage asking for support and help in the ways that again, you feel comfortable with, but that are going to help you overall feel better. Again, the biggest point I think is just making sure that you are kind to yourself and know that you're doing the best that you can with what you've been given, and really focus in on, the positive things that you're doing. Each day is an accomplishment, and each day that you get through difficult situations is a accomplishment. And so really focusing on some of those positive things. Those are all ideas of self-care, even though they're not all actions that you're doing for yourself, they can really help improve how you feel as an overall person and therefore as a caregiver. So whether that be, the physical actions like we talked about of taking a walk, or whether that be the more mental, emotional aspects of giving yourself a bit of credit each day that you get through, all of those things are really crucial for self-care.